let's turn our hat to legislation and compliance. And to help lead that discussion is our guest, Jason Westphal, who's legislative analyst with TASC, one of the country's largest and most innovative TPAs. Jason, good morning.
Good morning, guys. How are you?
I'm great. You're
Terrific.
coming to us from Madison?
Yes, sir.
I only have one thing to say to you, and then we'll have a positive interview. You guys beat my Buckeyes yesterday.
Yes, we did. A little bit of a hot streak.
It actually was a good game. It was a very good game, so, like it always is. So,
yeah.
Anyway.
Well, we have to give you a little bit of payback for that football championship game from a year ago. So.
Oh, yeah. We won't get into that, or we'll waste all this time, won't we? So. Jason, you obviously have your hands full with your current role and, helping, your clients and helping your organization, kind of keep their arms around compliance and legislative news. I mean, tell us a little bit about, what you're doing to really help your clients. And I can't let you get off this call without asking you a little bit about the Hatch-Paulson bill, too, that was just put through by, I guess, this week, right? Put in.
Sure. Yep. Absolutely. Yeah, I think it was introduced yesterday. So.
Yeah.
So I guess let's just start by saying that healthcare policy, it's nothing new. I mean, it's been around forever, but monitoring legislative and regulatory changes, ensuring plans are up to date, it's more important than ever today than it's ever been before. So I like to use, because I'm from Wisconsin, use a little weather analogy here. So before any, snowstorm or blizzard we get here in the upper Midwest, there's plenty of warning, of course. So meteorologists are constantly on the news predicting record snowfalls, so on and so forth, and that sends people into a frenzy of preparation. But even for a state like Wisconsin that regularly gets a lot of snow, having so much fall so quickly is a huge strain on everybody. And the same really applies when you're talking about an unprecedented amount of legislation or regulation that drops all at the same time. So let's just look at the last month or so and all the things that have come down the pike. So, you had the tax and spending package. So in there you had the Cadillac tax delay. There were things like transit parity, a VEBA fix for funded HRAs. Then shortly after that, you had 2015-87, the IRS notice that provided further guidance on the market reforms for group health plans, so on and so forth. Then after that, there was the delay on the ACA reporting. So I think you can see in both cases, whether it be weather or healthcare policy, it really is important that there's careful planning, proper preparation, and prioritization that helps organizations or our clients, dig out.
It's such a time drain for your clients, isn't it? I mean, it's just a resource and time drain for they to keep their head around all this. I mean, it's why you're important in this equation, but it's just, it's such a resource drain and time drain.
Yeah, it absolutely is. And I think that, employers need to make a decision where they're going to spend their time and resources. Are they going to employ, or give this job and charge somebody in their HR department with trying to understand and translate all this, or are they going to, outsource it? And yes, there's an expense with that, but there's also peace of mind and expertise that comes with that.
Yep. Ron, you got any questions for Jason?
Yeah, I mean, this is such a great area to talk about because it's so important. I was wondering how much activity or what part of your business might be focused on the concerns of the employer, and how do you deal with the privacy and security issues around healthcare information and data that's there? And is there any way that you help an employer who's done everything they can, but you can't do everything? There's going to be somebody challenge you. The risk management aspects, how do you help people manage that risk around the privacy and security?
Yeah, exactly. That's a perfect segue. So I don't know how many of your listeners know, but DOL had expressed a goal previously that they wanted to audit all employee benefit plans by the end of 2015. Now, obviously, that I don't think that happened, but right. They're increasing their budgets, and they're trying to hit employees and employers harder and harder as we go along. So I don't think that employers fully understand that things like ERISA and HIPAA and things like that are not an option, right. and the myriad of risks that a violation in those areas present. So I have a piece of data in front of me here that says 90 to 95% of employers have at least one ERISA or HIPAA violation,
right.
due just because of the confusion and complexity of the regulations that are out there. And it brings, upwards of $100 per day per employee fine.
Right.
And I think employers also need to know that this is not just a large employer or a group issue. It's also for the small guy, for the small employer.
Yep. Right. Is your main service to keep them informed, or can you refer them, or internal to your organization, do you provide the underlying legal services to help them be in compliance, or is it more focused just on the educational part, so that then they can look and find other outside resources and deal with the issues of privacy and security and risk management?
No, we actually do all of that in-house and can provide a client with any of those services. So, for example, my government affairs team consists of the legislative and policy side, which is myself, but then there's also a legal and a compliance component with that, which are both headed up by attorneys. So that's a good, strong base to start with. But then we are able to do both the information dissemination, but also any kind of processing that needs to be done as far as ERISA, HIPAA, the ACA reporting as the result of the employer mandate, the PCORI fee. We also have a new service called DocsBox, which does like a notice storage and dissemination service for things like for HIPAA and all those types of notices. And we're even seeing states come out with their own regulations and statutes as far as what notices need to go out and when. So it's hard enough to keep your hands around all 50 states on the federal level, but then you have to drop down into the weeds and see what a state like Wyoming or Alabama or whatever is doing.
Sure. Hey, Jason, what current advice or opinions are you giving your clients as it relates to the Cadillac tax? I know it's been kicked. The can's been kicked down the road a couple of years. What's
TASC's angle or position on it?
Yeah, I mean, where do you think it's going to end up? And no one knows, but
I think at this point, I think it if I was a betting man, I think it's hard to not see it either being outright repealed or heavily modified. I just, all of the presidential candidates, I don't care what side of the aisle you're on, have said, they've come out against it. There's strong bipartisan support in the current Congress. You've got entities like TASC. We've partnered with ECFC and other groups to really lobby and advocate on this issue. So, and I think that actually plays into the issue that we're talking about today, because if the Cadillac tax goes away, that's a whole lot of revenue that the government just lost.
Yeah.
And, they're really focused on this pay-for mentality. Well, where are they going to get that money? And to your point, nobody knows. I mean, you can't look into a crystal ball and predict it. But, you wonder if one of the areas is in compliance like we're talking about today. Whether it's in a ERISA audit, a HIPAA audit, if they really go after the employer mandate part, so on and so forth. So, our position is we want to see it outright fully repealed, but barring that, we'd like to see the employee benefit parts, and FSA and HRA, HSAs carved out of any language.
Yeah, at least that protected, right? At the very least, very least.
Yeah.
The account-based plan.
Yeah, because the goal was, Cadillac tax plans. originally when they called this out as part of the ACA, they talked about, they used Goldman Sachs as an example. Well, with the calculation the way it is today, you're going to get Goldman Sachs, but you're also going to get Frank Farmer as well.
Yep. Yep. We got about a minute to go. I was just going to give you an opportunity to kind of recap because we're at the end of the program. It's I wanted you to kind of recap and leave our audience with a few
takeaways.
Yeah, no, absolutely. I thank you for that opportunity. So again, I'd go back to what I said first, that this area and this arena is nothing new, but staying up to date and making sure your plans are compliant is just as important today as it's ever been, if not more so. Also, emphasizing the planning, preparation, prioritization, and then, talking about the services that TASC and other entities can provide in the area of, document storage and dissemination, ACA reporting, ERISA, PCORI, you name it. And it goes back to what we talked about earlier as well, which is employers and clients really need to sit back and decide where they're going to spend their money and resources and where they're willing to take on risk. And, by outsourcing some of these services, I think it provides them a peace of mind.
Good discussion. Very, very important piece of the whole puzzle, and I really appreciate you joining us today. You have a great weekend up in Madison.
Thank you. You too, and go Badgers.
Yeah, go Bucks. Thanks, Jason.